South Africa's Medical Act is the ultimate legal premise that governs the industry. It only came into effect in 2000. In this act, medical schemes have to cover the costs related to any emergency medical condition, a set of around 270 medical conditions, and 25 chronic conditions. These are called prescribed minimum benefits. Pre-1994, this was unheard of. Since its inception, this law has been a major challenge for medical schemes to contend with in both administering and making money, as well as for the regulator to enforce. And some critics suggest that certain companies are using the National Health Insurance Plan to deregulate the industry.
What is of concern there is an extensive lobbying, using the NHI as a kind of a smokescreen to argue for massive deregulation of the private system. And I don't think that that's sort of very well understood, but part of the motivation for the deregulation of the system involved virtually the elimination of any system of prescribed minimum benefits that protects people at the moment from the arbitrary withdrawal of benefit by a medical scheme. Now that really aids the commercial interests of the medical schemes. It doesn't help patients very much when they suddenly find out that they're not covered for MRI scans, they're not covered for cancer drugs, they're not covered for anything that really matters when you need it.
The regulator suggests that the direction the NHI is taking is very focused on the consumer.
I would be very surprised if something like that comes out. There's a very strong pro-people and pro-public and public protection ethos that is supporting this whole process. But to speculate at this stage is dangerous.
But the Council for Medical Schemes says that regulation is not a once-off affair.
There's constant lobbying against those PMBs, and there's constant lobbying for watering down of those PMBs. The reasons are very simple. The arguments always come forth that it's too costly, that no one can afford it, we'll go bankrupt, we'll not be able to survive. And you hear passionate pleas saying, we are bleeding, help us, take away these PMBs. That does not help. PMBs are there to protect you and me as members of the public.
What's clear is that the South African regulatory environment is already a challenge for both the regulator and companies involved. A national health insurance plan is set to either sort these issues out or make them more complex. With this uncertainty, it's no wonder that companies are turning to other countries to mitigate the possible effects of the NHI.
18 months ago, there was a kickoff in terms of natural progression, but I think the NHI has made it all the more necessary and rapid in terms of pace, because the small players may not find themselves having a room in the future NHI-based healthcare industry. And it makes sense for them to pick and choose a partner, one big player that they can be part of going forward.
Metropolitan already has a strong presence in other parts of Africa and is looking further afield.
It's always sensible to start diversifying your income, and I think one of the strategies we have is to see to what extent we can apply our business model in other large markets, and particularly in Africa and even in the Middle East.
Discovery started its foray overseas a few years ago. An unsuccessful attempt in the United States didn't deter it from venturing into the UK and China. But it says South Africa remains its base camp.
You've got to be careful in these markets not to. They take time. I think China is going to take a lot of time. It's really, in the healthcare side, embryonic. The government is desirous of having an active health insurance market with private health insurers. So it's all directionally very positive, but I think it's going to take time. But I don't ever underrate the potential of South Africa.
The NHI is proving an attractive investment opportunity for foreign players. General Electric and other providers have already been making waves in the industry, and there's a feeling that there are going to be more opportunities than not.
I'm very bullish about this. I think in 5 years' time, we'll see the first phase of a national health insurance fund being implemented. I think we would see some significant changes in the way public sector health is being delivered in South Africa. And I think we're going to see some more consolidation. The other interesting thing is I think we will see new entrants coming into the market. We're already seeing some new entrants come into the market in the pharmaceutical space. And if we look at how we license providers in South Africa and we start reforming even in that area, we might be quite an attractive market for new entrants into the market from overseas competitors.
And even if the healthcare industry changes substantially, for the most part, those who have medical aid schemes will probably still be willing to pay more to make sure they get the same quality healthcare they always did.
I believe even if there's additional tax, for the first 10, 20 years, most people will continue to buy private sector health plans until they really feel comfortable with the public sector quality of care has improved dramatically. So there's a bit of a tax burden, and the hospitals will see pressure on their pricing. But it's very hard to say, but I would say net, small negative for the sector, but I definitely would not be rushing out the door just because of this.
The healthcare space in South Africa is one that faces some unusual challenges. It's complex and filled with vested interests. The fact is that as an industry which directly impacts the lives of all South Africans, it needs to be in the best shape possible. And while many critics are concerned that the National Health Insurance Plan might not be the best way to achieve this, in the end, something's got to give. Whether it's this NHI plan or a better one or a combination of the proposed NHI and the current system. Either way, the private sector will be playing a key role. And just what that private sector will look like is anyone's guess. Thanks for watching South Africa's Healthcare Under the Knife.